COVID-19 has affected many people in many different ways. For family members of those who have died from the virus, it likely meant not being able to spend those last moments in person with their loved ones.
Well, now one family is thanking healthcare professionals who are filling in the gap when family can't be present. KELOLAND's Sarah McDonald shares this family's story.
I spoke with the family via video chat today, who tell me while they were unable to be with their mother and grandmother before she died, they got to share some moments over the phone with her thanks to the help of a caring nurse. Martha Evans' family members remember her as someone who made people feel welcome.
People always loved coming to her home, but it's really because she was so welcoming. She just made everyone feel special.
About 3 weeks ago, Evans was diagnosed with COVID-19. She had been living in a nursing home in Pipestone. After not recovering completely, she spent the last week in the hospital at Sanford.
Tracy's dad and I both took off for the hospital. He lives in Brookings and I'm in Pipestone. And then after we got there, they said they'd taken an x-ray and it looked like COVID pneumonia. And they retested her, and she was still positive for COVID 3 weeks after her first diagnosis. So then they made us leave, and they took her up to COVID critical care. And then it was about 3 hours later that we got the phone call that they didn't think she had more than an hour or two.
Priester then let family members know they should call Evans to say goodbye.
The nurse that was with her, and I'm sure there was a team of them, but the nurse that we talked to was so great. She was really good at just making us feel comfortable, letting us know what was going on, what Grandma was doing, how they were helping her interpret what we were saying and hear us well.
With the help of a Facebook post, the family is thanking that nurse for the comfort and compassion she provided during Evans' final moments.
I just knew we needed to get a real thank you to her. And so I thought, well, if Tracy will share it and get it to a couple of her Sanford nurse friends, I bet with about 15 shares we can find her. And we know it did reach her in about an hour.
While it is a hard time for this family, they are grateful for the nurse's kind action.
We just kind of all took our turn saying our I love yous and our goodbyes and this crazy, difficult time that families are going through, not just ours, and that nurses are having to fill in the gap for and bear that burden, that emotional burden with those families every day when they're going to work. It's really awe-inspiring.
Cardo says they have family in other states, and the nurse was able to help family members speak on the phone with Evans that day. I also reached out to Sanford about talking with the nurse. However, they had not heard back from her yet.